right, so we are now going to be performing Mcmurrays test. We're going to do this both specific to assess the quality of both the medial and lateral meniscus. So when we do this test, we are assessing specifically, this is a test that goes in a cluster of tests that can be used to try to indicate a meniscal tear. What we are looking for specifically is any clicking, any popping, any catching, or if the patient experiences any pain with either of these movements. So what we're going to have the patient do is lying supine. We're going to go ahead and bring the non-affected leg up first. We're going to bring him all the way into hip flexion. What I'm going to do from here is I'm going to go ahead and provide, to test the medial meniscus first, I'm going to provide an external rotation of the tibia. I don't want to bring the patient into complete full extension, but while fixating the patient in that external rotation from that maximal degree of hip flexion, I'm just going to go ahead and extend the patient. Do we have any pain with that? All right, then we'll come back. And to kind of get this test a little bit more specific to the lateral meniscus, I'm going to go ahead and provide an internal rotation. Again, being at the thigh, I'm going to just go ahead and extend the patient. Not quite all the way. Any pain with that? All right, so this would be a negative test for Chase. We go ahead and perform the same thing on the affected side of the patient. So I'd bring him into maximal degree of hip flexion. I'd go ahead and provide that external rotation. I'd be here supporting his thigh, and I'd go ahead and extend. Not quite all the way. Any pain with that? And then I'd go ahead and bring him back up and provide that internal rotation force at the foot and provide the same test. If I wanted to for this patient, I could also add a force, a verum and valgum force to more specifically stress this for the meniscus, but this would be for Chase a negative Mcmurray test.